Hi, Mr. Jones. My name is Sarah. I'll be the nurse taking care of you today. I have an order here to go ahead and section your tracheostomy tube, and I can hear that you have some secretions in there and your pulse oximetry level is a little low. It's at 90%. So I'm going to go ahead, wash my hands, and go ahead and provide privacy as well. I need you to say your name and birthday for me so I can confirm. Perfect. Thank you. So we'll go ahead and do some sectioning and a dressing change. It will probably take about 5 minutes or so. Would that be okay? Do you have any questions before we get started? All right, so I'm going to go ahead and put this drape on you just to make sure that we keep your clothes clean here. Okay, and you have the trach collar mask. I'm going to just turn the oxygen level up here. Okay. So we'll hyperoxygenate you before the procedure. I'm going to go ahead and raise the bed up. Okay, and then we'll put you into a semi-Fowler position and raise the head of the bed up a little bit. Okay, so I want to go ahead and get some PPE on. I'm going to put on my face shield and I'll put on my gloves once we get the procedure started here. I'm going to take a quick listen to your lung sounds. Okay. Yeah, I can hear some rhonchi. Normally I'd listen to a couple more and in the back, but I can't flip the Manikin for you. Okay, so I'm going to go ahead and get everything prepared. I have my suction catheter kit here, as well as some sterile saline. I'm going to go ahead and open my kit. Okay, there are some sterile gloves inside, so I will remove these and place them to the side. I'm going to also go ahead and open my sterile saline now so I can pour that when I'm ready. I have my suction on the left side here. So if I wanted to, I could turn the suction on now, or you can do it with one hand afterwards. It doesn't matter. All right, so I'm going to go ahead and open this package. Okay, sometimes you have to kind of pull the edges to get it to lay flat. Okay, and I will put on my sterile gloves. I'm right-handed, so I prefer to put the right one on first, but if you are left-handed, you can do that one. That's fine. It doesn't really make a difference. Okay. All right. To move the trash, pick up from the center and you can put it into your trash receptacle. All right, now I'm going to go ahead and get my suction catheter ready so sterile can touch sterile, so I can touch with both hands. I'm going to go ahead and pinch between my thumb and first finger, and then I'm going to wrap it down and around behind and hold it. That way whenever I let go, it's not going to touch anything because I've got control of it. Now just to get it hooked into the wall section, I'm going to hold it a little bit closer so I have better control. And I could go ahead and pour my saline in at this point. Okay, and then this left hand is now my dirty hand. It's non-sterile. So I'm going to go ahead and hook this onto the end of the suction catheter tubing here. And then I can go ahead and turn this on. Should be on continuous or regular, set between 100 to 120. You can hear the suction. I'm going to turn it off just so you can hear me. But listen when I change. When I tap on this valve, that's when it suctions. So you have to close it for it to suck through the tip here. Again, leave this on, but just so you can hear me. So what I would do next, I need to check my suction to make sure it's working. Note how my left hand stays only on this white valve and the big tubing, not the sterile tubing. So I can unwrap, tap, tap, tap to make sure the suction's working, and recoil this. At this point, I'm ready to do my procedure. I can go ahead and move the trach collar, go ahead, uncoil. I'm going to thread this down into the tube. Once I meet resistance or I hear the patient cough, I stop. I back it up 1/2 inch or about 1 centimeter. Then I'm going to tap and swirl for 10 to 15 seconds per suction pass. Okay, I recoil and I reapply the oxygen. They have to hyperoxygenate at least a minute between. Now I'm going to go ahead and clean my suction catheter here to clear out any secretions that might be stuck in there. In the meantime, I'm looking at the pulse oximetry level. I'm listening to see if they still have those rattling secretions, what their skin color looks like to determine if they need another suction pass. So we'll say that they do. They're still pale. They have a low pulse ox. It's been 1 minute. Move the suction or move the trach collar mask, release, and then I'm going to feed this down in again. All right, my patient coughs. I back it up 1/2 inch and then tap on and off this valve and swirl on the way out. Again, 10 to 15 seconds per pass. Done with this. Reapply the oxygen. And if I needed to do another suction pass, I could do this at this point and clean it out again. Or if I'm done, I turn my regulator off and then I can disconnect this piece here. And then this suction catheter tubing, that could then go into the biohazard. Meanwhile, I can hook this back onto my suction canister and keep that because we will reuse that piece. Okay. So at this point, I'm done with my procedure. I am going to move that. And I can go ahead, take another listen to their lung sounds here to see if they have improved. So we'll listen. Remember, stethoscope always goes directly on the skin. Okay. We'll say that they sound good, normal, clear in all lung fields. And we are going to go ahead while I have these gloves on still because they're non-sterile now, and I can remove this dressing here. So I'm going to slide out this gauze dressing. Then I want to look at my dressing and I'm looking for coca. So any of the drainage, the color, consistency, amount, and I'm missing one. Color, odor, consistency, and amount. So this again I can discard. At this point, because I need to start a new sterile procedure, I have to take these gloves off and get new sterile gloves. And then I'm going to use this kit here to complete the dressing change. You always must wash your hands between 2 sterile procedures. So I've washed my hands again. Now I can go ahead and open up this kit. Again, I need this sterile saline again. Okay. And this kit has some sterile gloves in it. It also has a drape. So I'm going to go ahead and use a new drape just to show you what's in your kit. Okay, so I've cleaned. I'm ready to begin here. I want to open my sterile saline pour bottle again. And then I can go ahead, I'm going to do the gloves first and then the drape because my gloves are kind of on top of it and I can't get to it. You can remove this drape right now and then lay it on your patient and then put the sterile gloves on. It doesn't really make a difference as long as you don't break sterile with your kit here. Okay, so 1 sterile glove and 2nd sterile glove. Okay, so now I can touch everything in the kit. If you have to move and reposition this kit, touch the inside to slide it to keep it sterile. We can open our drape now, and what you'll notice is that one side is kind of shiny and one is not. The shiny side should go down on your patient so we absorb the secretions. Now I am sterile, I have to be careful I don't touch my patient here. Looking in your kit, if you had a reusable cannula, you would need to go ahead and just clean. Oops, I'm losing things out of my kit. Clean with this one. However, hold on 1 second. However, we don't need to use this. We have the disposable inner cannula. So I'm going to go ahead and take this out of my kit. You can leave it. It doesn't make any difference. And then the pipe cleaners are for drying, so we don't need this either. I do need these two cotton-tipped applicators. I'm going to put them into this part. We have a new fenestrated gauze. Sometimes you'll hear it called a split gauze or a drain gauze. I have trach ties in here. And then I have some regular gauze as well. So what I'm going to do, I'm going to take 2 gauze, and I'm going to quarter them and stick them in this compartment so I can get these ones moist and keep the other ones dry. It's really nice to set up everything while you have 2 sterile hands. Much, much easier. Okay. So I've got everything set up how I like it now. So I can go ahead and dedicate one hand to dirty and one that will be sterile. So I'm going to go ahead and actually switch my gloves out. I put a mark on one so that you can tell as I'm doing the procedure here which one is which, just to give you an extra visual cue. Okay, so my right hand will remain sterile, my left hand will be not sterile. The primary role of the non-sterile hand is to stabilize the trach tube as you are cleaning. So what I would do at this point, I need to go ahead and dedicate one non-sterile. I'm going to pour my saline in here, and then I'm going to move the trach mask just so I can see a little bit better what I need to do. All right, so at this point, I can go ahead and change out this inner cannula. If you pinch the little flanges here, you can remove this. It's a little harder to get out of the Manikin, but you try to follow the curvature of this tube here. Now note, it does tell you, I don't know if you'll be able to see it, but right here, it tells you the size of the tube if you ever weren't sure. It also says on the flange here. So at this point I would dispose of this. I'm going to pretend that I had an extra one, that I had opened the sterile packaging, so we'll pretend I put it in here. So I've got my new sterile one. I can grab sterile hand and I can start putting this in. Now you've got to be really careful that you don't touch anything, so sometimes it's helpful to switch to the other hand. And then instead of pushing this down, pinch the little wings and clip it. It would hurt a lot if I'm pushing hard on this to get it to click. So I've changed my inner cannula. Now I need to go ahead and clean. So once again, sterile hand can grab my cotton-tipped applicator. I'm going to tilt this just a little bit. Don't do too much. It'll be uncomfortable. But I need to scrub right around that stoma, going outward away from it, and get the bottom side here. This would become trash. Then I can get my next one. I'm going to tilt it just a little bit, and I'm going to do the top part. Sometimes the secretions get kind of crusted and you've got to wipe them off really well. That one becomes trash. Now I can go ahead and clean with my moistened gauze. So again, I'm going to tilt up just a little bit and I'm going to clean under here. Okay, trash, sterile hand and sterile kit. I get another one and I clean under here as best I can. You could also clean the top faceplate here. Good to keep everything clean so there's less risk of infection. The last thing that I need to do before I put my dressing on is go ahead and blot it dry. Moisture is a risk for skin breakdown, so this is a really, really important step. So I am drying really well underneath next to that stoma. Okay, I could dry the top, and then I've got one more. So we'll dry underneath this part up top here as well. Again, being careful that you're not bumping things with your sterile hand. And then the last piece I need to do is go ahead and put the new dressing on. Now again, sterile hand only into sterile kit. Okay, so what I would need to do for this one is go ahead and his trach is on really tight, so we'll do the best that we can. We've got to thread this up under here. Okay, so I can get this side in pretty easily. This one's probably going to be a little tougher. No worries. Okay. Once we have this under, it is a really big deal to make sure there's not wrinkles. I'm done with the sterile part right now. Around the stoma needs to be the most sterile, so we do want to try to fix this so it looks nice and it's wrinkle free, because that is a possible point for a pressure injury to happen. So this looks good. The last thing that I need to do is go ahead and put on a new trach tie here. So I find it's easier to go down through the top than to try and lift it up. I'm done being sterile, so we just have to get these in. Okay. Sometimes you may have enough that you can pass both sides through. We'll see. Oh, that's not bad. All right, so you could do both, or you can tie on each side separately. That's fine. So I'm going to go ahead and pass this under. All right, then I can tie a square knot. So I do right over left and left over right, just like the first part of when you're tying your shoe. Some of the hospitals will have the commercial Velcro ones that are really nice. And then the last thing is to put 2 fingers underneath to make sure it's not too tight. The last step is to go ahead and cut off this old trach tie. I don't want to cut it off sooner, because if they coughed, this whole thing could come out. So we don't want that to happen. At this point, I need to clean up all of my supplies. I can dispose of the drape, dispose of all my trash. I can ask my patient if there's anything else I can do to make them comfortable. We can go ahead and lower the bed, do our safety checks. Lowering the bed. They were in at least the semi-Fowlers to high Fowlers, so if they want their position adjusted, I could do that as well. I can thank them for coming in today and allowing me to participate in their care. The bed is in the lowest position. The side rails are up, so I've got one here that I could put back up, but never all 4, because it's a safety issue if they can't get out. I've also, if they had needed oxygen all the time, I could put this back on, or if we're done hyperoxygenating, I can go ahead and take it off. And after that, call bell is within reach, so I could put it on their bed by them here. And that is it. They have in your checklist, you could listen to lung sounds one more time if you needed to, but we'll say he's okay. I'm going to go ahead and take my gloves off, dispose of these, and one more hand hygiene, and that's it.